2026. Let me show you what's about to happen. This chart shows a family of 2 in their 50s making around $85,000 a year. This year in 2025, they will pay around $600 for their health insurance every month. However, next year in 2026, the same couple, the same health insurance plan jumps to over $1,800. This is what experts are calling the subsidy cliff. This is because Biden's COVID Relief Act is expiring December of this year.
I just got back from urgent care and tell me why I went to go pick up my medicine at CVS. And the girl tells me, oh, like, your health insurance doesn't cover the 2 medicine you need. And I was like, okay, well, how much is it? And she told me the first medicine was $19. I was like, oh, okay, I guess it's not bad. And then she told me the second medicine for nausea, like when you're nauseous, was $200. And I humbly walked my ass out of there and I was like, hell no. I bought the other medicine for the $19 one, but not the $200 because, like, what the actual F? And why does my insurance not cover that?
Healthcare costs are so outrageous that there's a lot of people deciding if they even genuinely need it. Do they genuinely need something that we should all have? I'm not saying it should be free for everybody, but it should be to where everybody can afford it off of a minimum wage job. They shouldn't need other people to help them get it and still have to go through all the little loops. People like me, I'm 21 and young. I say, you know what? I'm a young and dumb 21-year-old guy. I don't need insurance because I'm pretty sure I'm not going to break my back or anything. And if I do, I was probably doing something stupid, and it's a lesson that had to be learned. Because why pay $1,000 a month? $1,200, $1,500, $2,500 a month, and still have to pay $8,000 deductibles, still have to pay co-pays, still have to wait 3, 4, 5 months. When if you go to Europe, you can walk inside. In America, if you have to get some medicine, you have to call your nurse, or call the hospital, book an appointment with your nurse, wait a week, 2, 3 weeks before you could go see the nurse, then have the nurse prescribe the medicine. And this is like a 1.5-month process, and it costs $300, $400, $500. In Europe, you walk in the store, say, I need this medicine. It's the same exact medicine. They give it to you. If they don't have it, they get it delivered in probably 2-3 days, and it costs $20, $30. That's just Europe. Asia's even cheaper. It gets to a point.
Oh, you want free healthcare? Well, I hope you're ready to wait a very long time to see a specialist. Okay, well, I don't have free healthcare. I live in America. And we just tried to schedule an appointment to see a neurologist for my husband, and there was a 4-month wait. Wait, there's more. I'm leaving my full-time job at the end of January and will be working as a 1099. So that means I need to get our health insurance on the marketplace. So let's see what that looks like, shall we? After I put in all the information for my family, which is 2 adults, me and my husband, and our 3 young kids, 2, 4, and 6, all of whom are healthy with no underlying health condition, which honestly should not matter, but of course it does in America. Let me tell you about the plans that are available to me on the marketplace. Better yet, let me show you. So here are the plans available to me. So cheapest one is $7.58 per month. And we scroll down and it gets progressively more expensive for your monthly premium. So let's go over the cheapest option. Okay, so my monthly payment would be $758.04 just to make sure that I have health insurance. That's $9,096 per year that we will spend no matter what, even if nobody in my family ever sees a doctor. But then, wait. Let's get into the deductible. Deductible is $6,000 for each individual person and $12,000 for the family. This is the amount that we would have to pay out of pocket before any of our expenses get covered, except for preventative care. Wait, there's more. So let's just say, God forbid, we need to end up using our entire deductible. Who knows what happened? God forbid we actually have to use our insurance. After spending the monthly premium and the deductible, which would equal to $21,000 that year, there's still a 50% co-insurance after you've already met your deductible. There's other professional services, x-ray and diagnostic imaging, and you better stay in network because if you go out of network, you're going to be paying 100% co-insurance. Same goes for medications. Personal favorite, 30% co-insurance after deductible for delivery and all inpatient services for maternity. Hey, you already spent $21,000 this year on healthcare, and now you decided to have a baby. You met your deductible, but you're still gonna have to pay more. It's a good thing we're done having kids. If you're an American and you still believe that you live in the greatest country in the world, where people are literally dying because they can't afford to go to the hospital or they can't afford life-saving medications, despite being one of the wealthiest countries in the world, one of the highest infant and maternal mortality rates compared to other developed countries, and now where your country is taking away your right to free speech under the guise of national security threat. In reality, they are afraid of everything that we learn, everything that we know from the community that we've built here on TikTok, finally realizing that we have been fed lies about this American dream. If you still believe that you live in the greatest country in the world, it's time to wake up, listen, learn, and stand up for what is right. For your own sake.
2026 is shaping up to be the most expensive year for employer-sponsored health coverage in over 15 years. According to Mercer's National Survey of Employer-Sponsored Health Plans, the average health benefit cost per employee is expected to jump 6.5%, and that's after cost-cutting measures. Without those measures, the increase would have been closer to 9%. So this marks the fourth year in a row of elevated cost growth, compared to a decade of increases averaging just 3%. So what's driving this? Two things: higher prices and higher utilization. So on the price side, advances like new cancer therapies and weight loss drugs improve outcomes, but they're expensive. Consolidation of health systems means fewer players with more bargaining power, and inflation, including higher healthcare wages, is adding pressure. So even AI billing tools are being flagged as potential cost drivers. On the utilization side, patients are catching up on care delayed during the pandemic. More staff capacity has opened, and virtual healthcare has lowered access barriers, especially in behavioral health. So employers are responding. Nearly 60% plan to make changes in 2026, most often by raising deductibles and cost sharing. So that means employees may see higher out-of-pocket costs at the point of care. So the bottom line, while innovation and access expand, working Americans are likely to feel the pinch in their paychecks and at the doctor's office.
Okay, how are people surviving? How are they doing it? I am the benefits administrator at my small business. I have less than 20 employees. I have 11 enrolled in United Healthcare. So we just got our renewal information. So we have 11 employees that are they just insure themselves. We have one that does them and their spouse. We have two that does employee and child, and we have one, that's me, that enrolls their family. So my family, it consists of my husband, myself, and our two young daughters. Okay, currently we pay $1,268 a month in premiums. So what premiums do is it just gets you access to the plan, okay? It's not any of your health insurance costs. We experienced for this year's renewal, so in 1 year, we had a 46.53% increase. Now for my family of 4, to have access to their health plan is $1,900 a month. That's $23,000 a year. We're all completely healthy. I don't really do the whole go to the doctor thing. We use it as we truly need it. I've got some real trust issues. But riddle me where the average family is getting $23,000 to pay for their premium. That's not to mention that once they actually have a health event, they have to reach their $5,000 deductible before the plan pays anything. It's so disturbing. So let's say that I had a health event where I broke my arm. I'd be paying the $23,000 in premiums, and then I'd have to pay another $5,000, so we're at $28,000 before I receive any assistance from this plan that I paid $23,000 to be a part of. Oh, sure, it does pay for my wellness visits where they'll inject my kids with A, B, and C. So that's great. No thanks. Ridiculous. This, United Healthcare, you should be ashamed. This is embarrassing, and this is not accessible for American families. or small businesses, because as a business, I pay part of this for my employees. I pay 50%. An individual rate went from $441 to $645. That's a problem for them. That's a problem for me. It's a problem.
I just got my last paycheck for 2024, and it has the breakdown of how much deductions I paid for everything: taxes, Medicare, Social Security, and health insurance. I want to show you how insanely expensive my health insurance premiums are. Now, for me, I pay bi-weekly, so every other week it comes out of my paycheck. The federal government, my employer, pays 75% of that. So I want to show you what it all came out to. So that line right there, that's highlighted, FEHB, Federal Employee Health Benefit. Per paycheck, I pay $187 and change. So the year-to-date amount that I paid personally was $4,870 and change. So the government pays 75% of the premium. So per paycheck, the government is paying $561.98, and per year, they're paying $14,611 and change. So that makes my total health insurance premiums to be close to $20,000 a year. Now, remember, premium does not pay for actual health care. It is just essentially the membership fee that allows you the right to ask your health insurance company to pay for stuff, which they then can approve or deny, and a lot of times they deny it. So the cheapest option for my employer, for a family, which is yourself plus 2 other people or more, is $139 per week. So that ends up being like $13,000 a year total between your part and the employer's part. The most expensive plan that they had was $532 per pay period for a family. So that ends up being well over $55,000 in premiums per year. And again, this is not even for health care. This is just for membership for the health insurance company, just to give you the right to ask them to pay for stuff. This is wild, and I hope some politician does something about this, because this is absolutely insane.